In today's video, I'm going to talk about neck pain, how to differentiate the different types of neck pain that you might have, and how to tell if structural integration is going to be a good match for your type of neck pain. So, if you are experiencing debilitating neck pain that causes you to be constantly wincing, walk in a funny kind of configuration, all bent over, and just generally holding the area tight, that's pretty extreme type of pain. I would suggest that prior to trying structural integration, now you can, but prior to trying that you go to a medical doctor or a chiropractor and get at least an X-ray, if not an MRI. Now, that's up to your doctor to recommend whether you get an X-ray or an MRI, but I would suggest that you ask them if you should first, because there may be more going on there. You may have a more acute injury that it's better to know what's going on if it's that intense first. I can help deal with it, but it's better to know first. Now, if it's not that bad, if it's just generally giving you headaches, or if you've got constant neck pain that's impairing your performance, perhaps you can't lift your head very well, perhaps you've got your head's in front of your body, perhaps, like I said earlier, you've got headaches, perhaps there's some TMJ pain, there may be a variety of things, whether it's on the upper neck just below the head, whether it's in the head, or whether it's down at the bottom of the neck and into the shoulder girdle. Those are two different types of neck pain. But for the most part, they will be resolved similarly. And what's nice is, actually, when we're talking about neck pain in general, almost inevitably the head is in front of the shoulders, and the shoulders are somewhat rolled forward. To the extent that the chest is opened up and the shoulders are rolled back, the head now has a support to sit on, directly sit on, without having to use all these muscles here to hold it onto the body for dear life. If your neck feels like a rock, that's part of what's going on. Usually it will happen in the front too, because you'll be pulling with your neck. You might even be trying to breathe with your neck. To the extent that your neck is hard like a rock, it will take longer to improve, but you will experience improvement. I have a pretty rough neck, but it's changed a lot over the years. Now, the very first session of structural integration addresses this postural situation, opening up the chest, bringing the shoulders back, and actually working on the neck itself, and getting the head much more over the shoulder girdle so that it's supported and not having to use these muscles to hold it up. That relieves a lot of strain there, whether you've had car accidents, whiplash, whatever you've had. So I suggest that you come in and try a first session. Now, again, in the context of this series of 10 sessions, sometimes people are discouraged. They see that there's 10 sessions, and I can imagine that it must be difficult to want to think about committing to doing 10 before you've even done one. So don't do that. Try one session, see if it's going to be right for you. If it is, you'll know, and you'll want to probably do the rest. If not, that's fine too, and I'll help direct you to a better resource.